Okay, so this is the presentation example lecture. So this is basically what you're going to be doing in 10 minutes or less. Now, why 10 minutes? Well, most platform presentations, if you're getting your opportunity to present your research at a national conference, a platform is about 10 minutes, maybe a little bit less. And so in that period of time, you need to be able to define the problem. What are the gaps in knowledge? What's your purpose of your study? What hypothesis or hypotheses will you be looking at? Describing your methods. Of course, then in that period of time, giving your results and having a discussion. Now, for our purposes, you're just going to be doing an introduction, a method section, and a statistical analysis. And with the statistical analysis, you're going to be focusing on the stats you're going to be using. You're not going to be going into the results. So here's an example that I'm going to kind of demonstrate for you. This was one that I gave at the Combined Sections meeting, the APTA's national conference that occurs in late January or early February each year. So this was an epidemiologic study. And so what you're going to do is something similar to this. What I want you to get from this presentation that I do is a general idea of what we're looking for when it comes to the content depth, the types of material that we're going to be going into. Now, I'm going to go a little bit further by having a results section, but that's okay. So I'm going to kind of give the complete picture. You will be obviously stopping with the statistical analysis section. Hello, my name is Dr. Jason Brummett, and along with my colleagues listed here on the slide, our presentation is Prior History of Anterior Cruciate Ligament Reconstruction is associated with a future ACL injury in female collegiate athletes. An ACL injury is a significant injury which will end the athlete's season. It will require surgical reconstruction in order to be able to return to sport, and this will include months of rehabilitation. Now, is having had a prior ACLR a risk factor for subsequent ACL injury? There have been some studies by Paterno et al. That have shown that high school female athletes are 16 times more likely to experience an ACL injury within 1 year of returning to sport, and 4.5 times more likely to experience ACL injury within 2 years of returning to sport. What is unknown? Well, female collegiate athletes, it's unknown what their risk of subsequent ACL injury is if they've had a prior reconstruction. So, the ability to identify athletes at risk for ACL injury is warranted. What kind of tools or screening strategies have been used to identify athletes at risk for injury? One tool is the drop vertical jump. The drop vertical jump, as illustrated here, involves an athlete dropping off of a 1-foot box onto the ground and then jumping up. It has shown early promise as a tool to screen athletes. However, subsequent studies challenge the ability of the drop vertical jump to discriminate ACL injury risk. Problems include these inconsistent findings. Are they at risk? Are they not at risk? What particular biomechanical faults put somebody at greater risk? And another challenge is not all clinics or universities have access to the motion capture technology in order to model biomechanically the individual during the performance of this activity. Could other functional tests discriminate ACL injury risk? Shown here are the standing long jump and the single leg hop. Both of these performed for distance only relying upon the lower extremities to generate the functional movement. You see here the individual has her arms held behind her back to avoid any contribution to the overall movement. Now, prior research has demonstrated a relationship or an association between standing long jump and single leg hop performance and non-contact time loss injury. Brummett et al. Has reported that single leg hop, side to side, asymmetry greater than 10% was associated with a fourfold increase in foot and ankle injuries in Division III female collegiate level athletes. A profile of a standing long jump less than 80% of one's height, bilateral single leg hops less than 65% of one's height, and an agility drill score, the lower extremity functional test greater than 118 seconds, was associated with a ninefold increase in thigh and knee injuries in Division III athletes. And looking at volleyball players, female collegiate level volleyball players, also a profile of less than 80% of their height doing the standing long jump, less than 70% of their height doing the single leg hop bilaterally, and a side to side asymmetry greater than 10% when doing the single leg hop was associated with a fourfold increase in lower quadrant injuries and a sixfold increase in foot and ankle injuries. So these tests have illustrated people at a potentially greater risk of injury. So the question here is, or the purpose of the study is to determine the risk of ACL sprain in a population of female collegiate athletes. And we're hypothesizing that female collegiate athletes with prior history of ACLR would be at a greater risk of non-contact time loss ACL injury. We're also hypothesizing that female collegiate athletes with shorter preseason standing long jump and or single leg hop scores would also be at a greater risk of a non-contact time loss ACL injury. This is a prospective cohort study involving 360 subjects representing volleyball, soccer, and basketball from the NCAA Division II and Division III, as well as the NAIA levels of collegiate competition. During preseason screening clinics, we collected prior injury history, as well as had them perform the standing long jump 3 times and the single leg hop 3 times. The average score for each was used for statistical analyses. You can see the breakdown per sport with the prior history of ACLR per each sport. And then you see at the bottom the non-contact time loss injuries per region during the study. And during the study, there were a total of 7 ACL injuries, 3 occurring in volleyball players, 3 occurring in soccer players, and 1 occurring in basketball players. And again, I want to highlight that these were non-contact time loss ACL injuries. So, a prior history of ACL reconstruction was associated with almost a 7 times greater risk of ACL sprain when competing at the college level. A prior history of ACLR was not associated with any non-contact time loss lower quadrant injury. Now looking at the functional test performance. So using previously reported data of a standing long jump less than 80% of their height and a single leg hop less than 70% of their height and that occurring bilaterally, that functional test performance profile was not associated with a greater risk of ACL injury. Functional test performance was, though, associated with any non-contact time loss lower quadrant injury, so athletes with that preseason performance profile were 1.6 times more likely to experience a non-contact lower quadrant time loss injury during the season of surveillance. So prior history of ACLR was associated with a greater risk of non-contact time loss ACL injury. Interestingly, though, 18 of the 20 individuals with prior history did not experience ACL injury. So it's a risk factor, but it does not mean that all individuals, in this case, only 2 of 20. Athletes with a prior history of ACLR were no more likely to experience a non-contact time loss lower quadrant injury. A battery of tests may help to identify athletes at risk for any non-contact time loss lower quadrant injury. So, female collegiate athletes should be screened for prior history of ACLR. Does not mean that they're going to go on to develop it, they're just at a greater risk. More research is warranted to improve our ability to identify athletes who may be at risk for ACL injury. And then here is my contact information. Thank you very much. So what you saw here, I went for just about, I think, 8 or so minutes. Of course, I went into the results and my discussion. What I really want you to get across in your introduction is, what is the purpose of your study? So I tried to highlight here that ACL injury is a devastating injury, and it would be nice to be able to know if collegiate level athletes were at a risk of injury based upon prior ACLR. And so I highlighted what was known and what was not known. I also discussed about screening tools, and the reason I did that is because the drop vertical jump is inconsistent or is not fully accepted, and it is also something that requires expensive equipment. So could inexpensive jump test help out? Talked about the methodology, and then finally the statistical analysis. That's what you're going to be doing for your presentation. Look forward to having more discussion with you on that in the future.